Usually when the sacroiliac joint is out of correct position, it will maintain and stay in that incorrect position for a prolonged period of time. Now, some people will have constant pain who present to me with SI problems. Some people have intermittent pain, that it only hurts when they do certain activities such as prolonged standing or prolonged sitting or prolonged lying. And by the way, that is the most common symptom that I see in patients with sacroiliac joint problems. They cannot remain in any sustained position. No matter what position they get into, it will begin to hurt after they've been there for a short period of time. Another common symptom, and when I see a patient, they'll come in and I'll say, well, now show me your pain. They almost will always point to the sacroiliac joint. That's called the Fortin finger test. They just point to the sacroiliac joint. That's very common, and yes, you many times and almost always will have pain around the sacroiliac joint itself. Now, I have had several patients who have come to see me that really didn't have any sacroiliac pain, but had growing pain. Now, if you, let's say, for instance, you're in a dysfunction where you have an upslip with a posterior rotation, that's just one example. It will malalign the pubic bone, and you can have pubic or groin pain, and that is a common symptom of SI joint dysfunction. Not every patient with SI joint dysfunction has groin pain, but a high number of patients do. Some patients will complain of hip pain, and you can see if this is how the femur is sitting incorrectly in the acetabulum, and it can create hip pain. It also puts a stretch on the iliopsoas ligament, and that's what's creating the groin pain many times. So the patient will present usually with pain in the SI joint. Many times you'll have radiating buttock pain. It's very common to have radiating buttock pain with sacroiliac joint dysfunction. Many patients will have posterior leg pain to the back of the knee. The most common cause for that is the sciatic nerve runs just under the piriformis. And if you have a sacral rotation, you're going to get a chronic stretch on the piriformis, number one. Number two, the piriformis is being facilitated by the brain to stabilize the SI joint. And so it becomes tight and will put pressure on the sciatic nerve, and you can get leg pain. And it's commonly posterior leg pain, usually just to the back of the knee, but sometimes will go further down the leg. The most common complaint, as I said, was sustained positioning will hurt. You cannot find a position of comfort. The patient will normally say, I have to constantly change my position to stay comfortable. And that is the most common complaint that I hear. Some patients complain with urinary frequency. That is more a female complaint that I hear, urinary frequency. Or pain with intercourse is another one. Most everyone will complain that they have increased symptoms with stair climbing or hill climbing. Very common complaint that I hear with sacroiliac problems. Common diagnostic tests will not show that you have a sacroiliac problem. X-rays aren't really good at demonstrating a sacroiliac problem. You can't really see it on a CT or an MRI. Even though there's not good diagnostic tests to demonstrate whether you have a sacroiliac problem or not, we can tell in the clinic by clinical evaluation. We do palpable tests where we test for the symmetry of the bones, and also we do movement tests to assess the movement of the joint. So we can certainly diagnose a sacroiliac problem through our clinical testing. So there's all kinds of reasons why people develop this, and that's one of the reasons I think it's so common. So let's talk about what we can do to fix this, and it really can be fixed. What I've done is I've developed a stabilization program where I work with a patient typically 6 to 8 weeks, and during that period of time I will see the patient and I will correct the malaligned sacroiliac problem and try to keep it in alignment. I will teach the patient how to self-correct. I would usually teach a family member how to assess the patient in correcting the sacroiliac problem. The goal is to keep the SI joint in alignment as much as possible so the ligaments can then tighten. If the SI joint is out of correct position most of the time, the ligaments are getting a chronic stretch and they're not going to be able to tighten. So the key to stabilizing this problem is to keep the SI joint in position as much as possible while the ligaments then begin to tighten. So I'm going to teach you how to correct your own sacroiliac problem through an exercise or several exercises. I'm going to teach you or show a family member how to help you with your corrections at home. I'm going to teach you the taping technique. I'm going to teach you the belting techniques. And you have to keep this up on a regular basis for at least 8 weeks. Usually most people will just see a gradual stabilization taking place as they progress through the program. So I'm going to teach you a pelvic stabilization exercise program and a motor sensory program that will hopefully help to stabilize the sacroiliac complex. And within 6 to 8 weeks, you'll be saying, yay, this feels really good, and I'm not really having very much pain now, and it's very manageable.